Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm your host, Evelyn, and today I'm excited to welcome to the show Dr. Barrie Tan. Welcome.
Thank you. Thank you, Evelyn. Looking forward to this. So hopefully this will be a good educational time, learning, and also a fun time.
Definitely a fun time. We'll be talking about vitamin E tocotrienols. We'll be talking about geranylgeraniol or GG and the research that's been done on these compounds. Dr. Tan has a doctorate in chemistry. He became a professor of chemistry and food science and nutrition at the University of Massachusetts. His research expertise is in carotenoids, vitamin E, CoQ10, and omega-3s, and he was the first to introduce the benefits of tocotrienols to the nutrition industry. He's also the chief science officer at Designs for Health. And Barrie, we are so lucky to have you. So thank you.
Thank you so much.
You've done multiple webinars with us. I think many practitioners have heard your story, but I love hearing it every time. I know that you discovered tocotrienols in palm oil, in rice, and in the Annatto plant. Can you please share the beautiful story of how you stumbled upon the Annatto plant?
Yes. The year was 1994. There was an ophthalmologist at Harvard, and she discovered that on the back of the retina, there's laden with lutein and zeaxanthin, and it would filter the blue light. Today, everybody knows to do that. And they said, well, why is he sharing that? Well, that was the reason I went to South America to look for the giant marigold plant that have lutein and zeaxanthin. So I went to South America looking for this plant to extract. I was not there looking for any tocotrienol. So I went and I did find the giant marigold. So I found what I went there to look for. Then fate has it. Literally 20 feet away from me, I saw the beautiful Annatto plant. Now, I don't know if the audience knows this. Lutein and zeaxanthin is a carotene, a carotenoid. The intense red color, I know some of the audience can see this, the intense red color of Annatto. We use it for coloring cheeses and some ice cream and some other food stuff. They are also carotene. That carotene stains your finger. If you touch it, it stains your finger like you pretend I touch it. It stains your finger here. But if you think of mostly carotene in life, they are very unstable. And people say, wait a minute. How can carotene be unstable? I'll be cooking carrot and the beta carotene is good in the carrot. I'll be cooking a tomato sauce and the lycopene is good in the tomato. Good question. Those beta carotene and lycopene are inside the cell of the carrot and inside the cell of the tomato. But when I touch this Annatto plant, it stains my finger. Enough that the British have nicknamed this the lipstick plant. So I realized that, so it's not inside a cell. I was guessing. There must be a very potent antioxidant that protects this carotene from degrading. I thought that it was a polyphenol because many people take polyphenol like resveratrol, berberine, and many of these other things like that. But it was none of that. So it was only a vitamin E molecule that protects the oxidation. And then, furthermore, it does not contain tocopherol, which is rare. And most surprisingly, it only contains tocotrienol and the two most potent ones. I just thought that, man, somebody up there is looking down on me on this. I didn't even go to South America to look for this. I was looking for lutein and zeaxanthin, like I told you. So that was 25 years ago. I came back, analyzed it, found out that it was the most potent vitamin E, the delta and gamma tocotrienol. Of course, by this time, I've already left the university. I've spent an earlier 15 years or so studying vitamin E tocotrienol. So when I discovered this, I decided that I got to stop everything and figure out how to get this out, how to do study, and how to do clinical trial. So that has marked the entire two decades of my life. I was going to say 2 centuries. I'm not that old. 2 decades of my life.
That's amazing, Barrie. Take us back a little bit in terms of vitamin E research. So within vitamin E, there are 8 isomers, the tocopherols and the tocotrienols. Most people are familiar with or have supplemented with tocopherols. What are some of the differences, both chemically, but also from research between tocopherols and tocotrienols?
The first discovery of vitamin E was alpha tocopherol. And that was found in spinach. It's not a lot because vitamin E are found where they are oily material. And there's not a lot of oil in spinach. But that's where they found it. It was first discovered by 2 pediatrician medical doctors and scientists at UC Berkeley exactly 100 years ago, 1922. And then they found that this material is able to preserve the fetus until full term. People may or may not know this. People know that vitamin E is an antioxidant. It actually helps the fetus to go to full term so that the baby is born. Because there's a lot of challenges to the fetus growing, so they need protection. So because of that, vitamin alpha tocopherol became a vitamin, and they just put the next letter E like that. That was a beginning. About 50 years after that, they discovered tocotrienol. So tocotrienol is kind of like known much later. Then in the 1980s and 90s, there were a lot of vitamin E studies. And if somebody Google vitamin E in the 1990s and even into the year 2000, most, if not all of those vitamin E studies fail. So, and you can Google this. It's not a threat to me. But at the time, I was a young assistant professor. I said, oh man, somebody is going to throw the baby with the bathwater and I'm gone. But I persisted on the tocotrienol study. If you look at those studies carefully, they are doing 2 things. They only use alpha tocopherol, and furthermore, they use synthetic alpha tocopherol, most of the study. So that those studies fail. They try to do it on many chronic conditions, fail. At best, and at worst, it may even cause women to have breast cancer, men to have prostate cancer. So then everybody just froze, That's with the tocopherol. The tocotrienol, meantime, I started at the mid-80s. I persisted to do research work, and I said, oh, this tocotrienol inhibit cancer, inhibit the ability to lower cholesterol, all animal study. Then when I discovered the Annatto, I decided to extract them. Then I realized, hey, I got to do study with this delta and gamma tocotrienol. So, and I did a lot. So to date, I probably have 100 papers on animal study on it. So approximately 15 years ago, I started to do clinical study. And we have today about 25 or more clinical trials on various things about tocotrienol and geranylgeraniol. So that's where, so the difference between the two, chemically, the difference is easy. I'll put up, I know those who are not watching video cannot see. This is the structure of tocotrienol. So if I show you this, you see there's one double bond here, one double bond here, and the last double bond here. And chemically, double bond means ene because there are 3 triene, and hence this is tocotrienol. Otherwise, if there are no double bond, it will be tocopherol. Because of the 3 double bond, the tail is shorter, so therefore it can protect the cell membrane approximately 50 times better than tocopherol. So that would be a functional difference. But if it's a chemical structural difference, it just have 3 double bond and the tocopherol is fully saturated with no double bond.
You're definitely a chemistry professor at heart. So our practitioners have patients who are very smart, very educated. They have seen some of this research, probably read it about the dangers of vitamin E. How can a practitioner best explain to his or her patient why we want to use tocotrienols instead? And how do they work? Is it that they are more anti-inflammatory? Can you get into that more?
Okay, I'll answer the first part. How can a health professional explain to their patient? And then what about the difference in terms of benefits like inflammation or oxidative protection? The first part. There are 4 tocopherols and 4 tocotrienol, and they are simply using the Greek letter alpha, beta, delta, gamma tocopherol, alpha, beta, delta, gamma tocotrienol. And of these 8 molecules, only alpha tocopherol has a transport protein. Now, that's a big word to use to help the patient understand. Transport protein, if you take food, if the compound is not something special, it will be broken down somewhat, and then by passive diffusion, high concentration outside in your gut, and your gut here, and this is your system, it will diffuse from high concentration to low concentration. So it's a mechanical thing. A transport protein meaning that it have a rite of passage. It will just chaperone the compound you have and go right through. Compounds in a body have that kind of transport protein. Example, retinol, vitamin A. It gets absorbed into the food, but it specifically go to the retina. So if it goes to the retina, that's a very specific place in a part of the body on one part of the eye. Among the vitamin E, only alpha tocopherol has a transport protein. It's referred to alpha tocopherol transport protein. So if you want to use a simple analogy, it's not difficult. If you happen to have a ticket to go to the Oscar, you probably have to line up all night long like that to wait for your line to go through. And then comes a limo. And then out comes Nicole Kidman. She does not have to wait. She will just go right through because she has the rite of passage. Like this. Very simple, not complicated. And some compounds have that. Alpha tocopherol has it. Retinol has that. Some other protein and things have it. But most of the other tocopherol and tocotrienol do not have it. So they have to have passive diffusion. So when people take a lot of alpha tocopherol vitamin, they go straight into your body. We have no idea what the tocopherol does. I think that it is because of that the large clinical trials fail. So my judgment call is this. Do not take supplemental alpha tocopherol. It is fine to take the alpha tocopherol from the food and vegetable that you eat. If you do that, you probably consume about 10 milligram, 12 milligram a day. That would be fine from the vegetable oil, the avocado that you eat. And then if you supplement, then supplement tocotrienol. So the tocotrienol will go straight to by passive diffusion and not mess up. The second part you ask is, how would you explain the benefit to the health profession, to the patient, that is better than tocopherol? We have done many animal studies, and we have 25 clinical trials to show this. Almost always, Evelyn, we try to measure oxidative markers like fat in your blood. Are they oxidized fat or regular fat? We try to measure inflammation marker like C-reactive protein. Doctors can do this on a patient. Sometimes they get fancy. We can study interleukin-6 and other blood-borne markers. And when we do this, we systematically see oxidized fat and interleukin-6 or C-reactive protein decrease, typically 20% on the low side, 40% on the high side. So it calms the body oxidative stress and calms the body's inflammation we see that consistently with tocotrienol, and we see that sometimes with tocopherol and sometimes not. So that would be an easy way to pass the information to the consumer.
Since you touched on the studies, I'd love to get into those. Can you tell us more about the human clinical trials that have been done? Like which specific conditions, what are the doses that were used in the studies, and what were the outcomes?
Okay. Here, I'm going to give you a choice to ask me. I will tell you all the clinical trials we did on chronic condition. We did it on chronic conditions, and I mentioned them. And then then you can cherry pick. Oh, can you talk to us about this like that? And then I can tell you the dosage and then the function.
All right.
We first found this out from animals study, and we saw that they consistently reduce their inflammation. Then I said, okay. So what kind of condition cause inflammation to go up, and how do we go about study in human? Then I found out, then I considered that chronic conditions are the one that is most forth bearing on this area. Then I decided to choose the one that have the largest subset. So therefore, we study people with dyslipidemia, which means triglyceride and cholesterol are high, dyslipidemia. We study people with prediabetes, so the sugar and fat is moderately high, but not high enough to be diabetic. And then we study people who are type 2 diabetics. And we are now studying men and women who with obesity. So all these are chronic conditions. And lastly, probably the one that I'm most gung-ho with, we study people who have fatty liver disease. Now, so non-alcoholic fatty liver disease. So if you say this group, people who are dyslipidemia, probably 60 million people. People pre-diabetes, 95 million, 100 million people. People with diabetes, 35 million. People who are with obesity, about 25%. I don't know what that come up to, probably 50 million. And then people who have fatty liver disease is about 90 million. Of course, these are not additive. Some of them overlap. They have two or three. In other words, some people who are overweight, obese could have fatty liver condition. So I would say that we cover probably 100 to 150 million people. So if you think about Annatto, tocotrienol, and what is used for in a Delta Gold, it probably matches 150 million people should be taking this supplement. So how about you now tell me,
all right,
which one would you like me to cover?
Since you said you're the most gung-ho about non-alcoholic fatty liver disease, I wanted to ask you about that one anyway. Can you talk about the changes that were seen, the parameters that were studied? And I imagine that some of those are related to some of those other conditions as well, right?
Yes, they are related. Oftentimes, people who have fatty liver disease, they have metabolic syndrome, so their condition overlap with those who are pre-diabetes. We usually, when we choose people with NAFLD, fatty liver disease, we do not usually choose them who are diabetic, because diabetic already currently are taking many medications, so that's very confusing when they try to randomize the study. So in this fatty liver thing, the sugar is normal high, but not high enough to be diabetic. The triglyceride is high. And then when they did a liver scan, they can see that there is steatosis, which means a fat store in the liver. So in this one here, we have already done earlier trials. People are familiar sometimes with the phrase dose dependent. So they give, let's say 100 milligram, 200 milligram, 400 milligram. Those are dose dependent. We have already done dose dependent study, Evelyn. So we are not looking to do dose dependent study. We knew that 600 milligram worked perfectly. And you can buy tocotrienol out there. They are 300 milligram taken twice a day. So instead, we study time dependent. So first we did a 3-month study. In the 3-month study, we wanted to know if the tocotrienol would lower the stress enzymes produced in the liver, like ALT, AST, and the stress enzyme drop. So it's very neat. We can see it. So I said, okay, good. Then I decided I need to do further on a 6-month study to see if that would work. when we did the 6-month study, we still did the enzyme. Now we study C-reactive protein, interleukin-6, and then we also study steatosis. So you use an ultrasound like you see a fetus in a woman's womb. You can also use ultrasound to map the liver to see if the fat is there or not. And we saw that the steatosis also dropped. Very positive, like that. And then we also measure metabolite stuff like triglyceride, sugar, cholesterol. They drop moderately. Very positive. And then I decided that I need to do a 1-year study. 1-year study means 2 years. By the time you recruit people and do it, these are lengthy, time-consuming, not to say the least of which is also cost. So we did one. You know why we did that? We did that because the liver is the largest organ in the body. I wanted to have the affirmation. If it works in 3 months, 6 months, if it continue to work up at 12 months, then this is really good. That's my intent. But there's a last thing why I did this is a motive that drove me in the back, but I saved that last to do so you won't get distracted. So on the 12-month study, we studied all the things we did in 3 months and 6 months. Remember the independent study. They're all given 600 milligrams. They're no dose dependent, only time dependent. So we did the 12-month study. This time, we want all the earlier markers I mentioned to you. Plus, we need to have a CAT scan to see if you have too much fat in the liver, the fat causes the liver cell to have fibrosis, which means they have scarring tissue. That's not good because they're getting into a direction that cannot be reversed. If it's irreversible, NAFLD become NASH, NASH, non-alcohol steatohepatitis. So you don't want to go there. If you're in NASH, then you cannot do any more. Then you put your name on a liver transplant. Whereas it is still okay to put your name on a liver transplant, but keep this in mind. There are 90 million people with fatty liver. There are simply not enough people, even if they were to donate their liver to transplant 90 million people. So this is not a good thing. Even if you're on the liver transplant, you're almost going to wait and you're probably going to die waiting. Now, another point I want to make here, I know it's kind of like, I don't mean to be moral, but I'm just making a statement. About 30, 40 years ago, it was a religious reason why people drink alcohol too much. They have cirrhosis of the liver. So they just can't control the alcohol. Nobody then would have ever believed that if you consume a lot of carbohydrate and sugar and fat, you have the liver exactly the same that can be damaged by alcohol. If you think about it, it's incredible. Alcohol is a very powerful drug that can damage the liver. Normally, if you drink alcohol, the alcohol is metabolized. But if you drink so much, the liver can't handle it. So over time, the liver became fatty. And now, can you imagine that? Dietarily, we can have the liver like that of alcohol. It's just unthinkable. But it is happening. And so there cannot be 95 million alcoholic here. It cannot be that. So these 95 million people are because of food thing. So anyway, I got carried away there. So on the 12-month study, we saw that it has reversal of fibrosis. I remember my colleague Ann here told me, he said, Barrie, did you notice that on the 3-month? I noticed it. Then I said, I don't want to think about it. I told her. Then there's a 6-month study. She saw it again. Then I tell you what it is. We saw that at 3 months and 6 months, the patient lost weight. They lost 10 to 15 pounds. And then I became uncomfortable. I'll tell you why. And then at 12 months, they also lost 10 to 15 pounds and said that, Barrie, you got to pay attention to this. They lost weight at 3 months, 6 months, and 12 months. And then I told her that I was uncomfortable in this because if I start mumbling this, people is going to say that this tocotrienol is weight loss. And weight loss, people looking for something in 2 weeks or 4 weeks. But I don't have study in 2 weeks. My shortest study was 3 months. Then Anne said, well, then just tell people that it is the 3 months they lost weight. They said, don't say anything about the 2 weeks because you didn't have the data. Then I said, Oh yeah, I wasn't thinking, but you see, I was so adverse to this thing about weight loss thing. I think that the inflammation and the whole metabolism in the body is so out of kilter. So when that thing begin to come back into balance, the weight accommodation is go back. So now I'm more comfortable to report that at 3, 6, and 12 months, they have sustained weight loss 10 to 15 pounds. And most of these fatty liver patients were overweight anyhow. So weight loss is a good, it's not the cake, but actually it's icing on the cake. So we reported this. So I am just thrilled about this study on this fatty liver thing. So it doesn't cure you from NAFLD, but it provides a modicum of addressing a fatty liver situation. So if the practitioner out there, you have all the numbers on the blood panel. You ask the patient to come back 3 months after and you do the same blood work, and you can email me. I'll tell you what blood, I'll send you the paper. You can do exactly the same protocol that you will do there. And if you do this, you don't need me to convince you. You will be convinced and your patient will be convinced. And if the patient stand on the weight balance, they will know the weight loss. They'll be the first to know before they even tell the doctor like that. So I'm really thrilled about that.
I have 2 follow-up questions for you. You said time dependent. So I want to talk about, do you take tocotrienols without food, and why? And also, is there a certain amount that you shouldn't take at once?
About 7, 8 years ago, we did a study. We gave people all at one time, and that's how we came up with a number. I'm trying to answer your question. We did approximately 100 milligram, 200 milligram, 400 milligram, and 800 milligrams, something like that, all given at one time. So when we did that, we saw that somewhere in about 300 to 350 milligram is about the top at one time, meaning that when we gave people at 200 milligram, say the absorption was here. So if you give them 400 milligram, you would expect the absorption to be double, but we didn't. The 200 milligram here, 400 milligram here, and then at 800 milligram here. So I got a feeling that the more you gave people all at one time, the body cannot handle and cannot absorb. So we deemed that the 300 milligram would be 350 would be the peak. So if you go there, Design for Health Cell at 300 milligram isn't because I instructed them. Anything more is not going to help people like that on the absorption piece. So when people need to take 600 milligram, like the fatty alcohol study, they take 300 milligram at separate time. And we ask people to take tocotrienol because it's oil soluble with a meal. So they can either take it with breakfast or lunch or dinner. As to when it's taken doesn't really matter. I take mine with lunch and dinner because at lunch and dinner, I have a little bit more fat. More fat it is emulsified better and absorbed better. And breakfast, I usually may have a scone or a piece of toast and coffee. So there may not be enough fat. So I do not take tocotrienol with my breakfast. So I answer your second question as well. So those are the 2 ways to do it.
And I also have a question about the inflammation. So obviously it's lowering markers of inflammation. Is that through upregulation and downregulation of certain genes? Like, how is it impacting genetic expression? Have we looked at that?
Yes. I actually, that's a very good question you asked. You can see my bias. But I answer your question, I tell you why I don't usually speak about them. It silence more inflammatory gene and pro-inflammatory gene. And many people have done animal study and clearly show where it knocks out so that the inflammatory gene is silent. And so therefore translated the C-reactive protein drop and the interleukin drop. We even did that on a clinical study. We measured the microRNA. So when we saw, like for example, we measure a marker that show that if the marker is reduced, the fibrosis on the liver is reduced. So I like that, it's a fibrosis marker. So these scientists go back and study the microRNA of this fibrosis marker and saw that the microRNA is also dropped. So there's a gene expression like that. So there you have it. So now I have to tell you my bias. Why do I not talk about that even though it's so positive? Having read hundreds and hundreds of papers, people have a lot of this gene expression thing. And when they explain this gene expression, then they say it's this mode of action. Then they have this other gene expression here. Then they have this mechanism of action. And then there's something else. Then there's another mechanism. So after you read 100 papers, I'm thinking, wait a minute. You have 100 ways to do this. I'm finding myself hard to believe it. So I usually take it. I believe it, but I take a grain of salt. But if you tell me a blood-borne marker is working, then I believe it better. And I believe the most when you actually give a phenomenon. I call phenomenon, meaning that if a doctor can perform ultrasound on the person's liver, or you do a CAT scan and you see that the steatosis has gone down and the fibrosis is reduced, wow, that is something. But of course, you cannot be all that. If it's all that, then you have people say, oh, I took 300 milligram tocotrienol and I lost 10 pounds. That's fantastic. See, that it may come across as not believable. It's just my testimony. So there must be a part that has to do with a clinician's expertise to a personal wellness when they take certain supplement. And then usually I look at markers. Occasionally, when I don't look at markers, I let the scientists decide. Like we are doing tocotrienol now on dysbiosis because it helped in the blood. And so they are studying what kind of gene expression has gone up and what have gone down. And what seemed to go up are the good bugs gene. And what seems to go down are the bad bugs gene. So they are trying to go to the nitty-gritty of it. But for me, I would be satisfied if you tell me the good bugs go up and the bad bugs go down. You know what I mean? So is that attention? So, but it is a good thing. So far, all our genetic study help to support the understanding that the tocotrienol works.
Yeah, I just love hearing some of the science behind it, but it is true. What's meaningful for the patient is to actually see, physical changes, and obviously, changes in how someone feels, but then also see that on lab work. But it's still fun to get into the science. And actually, I have probably 50 or more questions here to choose from. but what's funny is one of them was on whether tocotrienols have any impact on the gut microbiome, and then I thought, no, I'm not gonna ask it, but you just went into that, so that's really cool. Before we switch our focus to GG, I do want to touch on, we talked about cardiovascular a bit through the non-alcoholic fatty liver. I want to talk about skin health briefly and about bone health, because I think that's an area where we wouldn't maybe think of tocotrienols. So on skin health, I know there's collagen is, everybody's taking collagen. The beauty from within concept is super popular. I remember seeing some studies on tocotrienols in skin health, and I believe also hair growth. And my question to you is, can you just touch on those briefly? But I'm also curious, vitamin E, alpha tocopherol, is used a lot in topical skincare,
yes,
either as a preservative or as an active ingredient. Do you know if there is any problem with using alpha tocopherol topically, or should we also be using tocotrienols in skincare? Just curious from my own.
I think on the skincare thing is if you look at alpha tocopherol, if it is actually for the skin, then it would not be alpha tocopherol acetate or alpha tocopherol palmitate. If you see them, if it's not the free alcohol, alpha tocopherol, then as an acetate or palmitate, then it's using purely as an antioxidant to make sure that the cream is not oxidized. It's just like this. Vitamin E and skincare does matter. I have not done enough work on this, a study on this. We have done earlier animal study. It has humectant property. It has reduced blemishes because it reduced the melanization as we age. It has that component. And of course, we study things that are hyperplasia, which means like psoriasis. It's kind of like not cancerous, but it's going that direction. It's autoimmune. So if you apply that, it would also reduce that. We have also had people who have melanoma, and the tocotrienol would work. But oftentimes, I encourage people, because all the animal study, they're taken orally, but people have skin cancer and they apply it. They just cut off the soft gel and apply it on the skin of the animal. They have melanoma, or they are part of the body that have many stories like that have helped them. But you are talking about skin health as in normal skin health. I only have anecdotal evidence. On animal study, lots and lots of study. And I believe that it does work on the skincare because you mentioned collagen. Collagen is a subcutaneous layer of your skin, and we begin to thin, so the skin begin very thin as we go older. That is what collagen is supposed to make the skin feeling supple. Tocotrienol and vitamin E do not work like that. Instead, the tocotrienol get into the cell wall of your skin and protect your skin from oxidative damage, such as from the sun and such as from ozone and such as from toxicant that land on your thing, like smog. Sometimes we drive in the middle of LA, you can swipe your hand, you can see dirt on your hand, that kind of thing. So it's your own sweat that have toxicant and toxicant from the environment, UV radiation, ozone, like that. If you do this, well, collagen doesn't help you like that. It's just making your skin supple. But tocotrienol literally will protect your skin. But we don't have many people using tocotrienol to put skincare. They should. But I think until there is one, I do notice that if you take tocotrienol supplement, it will deposit on the viable layer of your skin. Now, this may sound, I'm not mentioning names like this. I have a Japanese professor. He gave tocotrienol to women with breast cancer. That's very serious, And about a year later, I asked him, how are your women with breast cancer doing? He said that they are still waiting for biopsies, but their tumor is not growing and not moving forward. Man, that's good news to me. Then he said, oh, I have a good side effect to tell you. He said, what? He said, many of these women have to go to radiation. And that part of the body does not look pretty when they go to radiation. So when they took tocotrienol, their skin are not inflamed and they are more supple. Then I said, aha. So now I didn't say in front of him. And of course, the ladies who had this situation, it's not a negative thing. It's a positive thing. So clearly the tocotrienol is bearing implication to positive benefit to the skin. It is a side benefit. They care more if the cancer is killed, like that. So I think that they have bearings there on the skin health. So that's the best I can do. I don't have too many people taking me on to apply on skincare other than orally when they take it, their skin got better like that. So that's that piece. You mentioned bone health.
Yes. Let's get into that.
There are hundreds of studies in animal on bone health. You use cigarette to do it. Cigarette to lower the bone density. People take steroid drugs, lower the bone density. They have ovarytectomized rats that will simulate postmenopausal women. They have orchidectomized. I didn't even know what that means until the person did the work. Orchidectomized means that they remove the gonads. And then so therefore the male rats will become like 65, 70 years old. So when they did that, the bone density decreased. And then when they gave them tocotrienol, the tocotrienol fortified the bone. How about I leave that piece on bone health? When you talk to me about GG, I will tell you a perfect supplement that help in bone health is the combination of GG and tocotrienol. But for tocotrienol, we did one clinical trial. We have biological markers. Basically, the osteoblast increased and the osteoclast decreased, and overall, the balance of the two is better as she age. We are all doing it on postmenopausal women. And then also the oxidative marker also was suppressed because when the estrogen dropped, by the way, estrogen is an antioxidant. So her estrogen is actually a protective antioxidant. So during the menopause, it dropped. So therefore, the oxidation increased, and tocotrienol is a powerful antioxidant. It reduces the oxidative marker and inflammation drop. So we have that also. We noticed that in that study, we have a placebo group, 300 and 600. We found that the 300 works really well, and the 600 did not buy much more, little more, like 10% more. So if it's 100%, 600 would be 100. We didn't see 200%. We only saw 110% with the 600. So therefore, for bone health, 300 milligram would be just fine.
Okay. I do want to talk about GG more. And also thank you for touching on the skincare part. I haven't been taking my tocotrienols every day, but I think you've just given me a reason to take them every single day. And I also did want to point out, if you're watching this, I have this book right here, but if you're listening, The Truth About Vitamin E is an excellent resource that also goes through the trials. And of course, we have so much information that we'll share in the show notes as well. And Barrie, I'm wearing yellow today to match your book.
Yes.
Okay, so let's talk about GG. So I've pronounced it geranylgeraniol. I think you call it geranol. We'll just call it GG.
Yeah,
right.
We'll call it GG. That would be good now.
So I'd love to know, well, first of all, how you discovered it, because you discovered that in the Annatto plant as well. And then also, I still sometimes get lost explaining GG to a practitioner. So explain to me, not as if I'm a fifth grader and also not as if I'm in your college chemistry class, but maybe like high school biology, something in between, where it is in the body, because it is endogenously produced, what its functions are, and talk about the mevalonic acid pathway.
On the discovery part, I mentioned to you that I extracted the tocotrienol. I found that to protect the color. So when we found the process to do this, we first remove all the color, and then we use a physical technique, no chemical, no nothing. We just use an extraction technique. We take out the tocotrienol. I always found in the bottom of the pot something that looked like dark yellow color, little bit light brown color like that. I didn't know what it was, but I thought that, man, I already got my Delta goal, just metaphorically. I got my goals. I'm fine with it. But then I'm a curious scientist, So I don't know what it is. I had to check it out. So I check it out, and then I analyze it. I found that this compound, geranylgeraniol. Then I said, I don't know what this compound is. Then I did literature search and said, this is an endogenous nutrient. This is a nutrient that our body makes. Then I dig further deeper into it. Oh my goodness. This is also an endogenous nutrient in the plant. So right now, so I told you the discovery story. So now, how is it working? Before I tell, of course, we are all anal. We are mammal, part of the mammalian system. So we want to know how it works on a human being. But if I tell you this, then this may surprise you. When you go eat your food, your lovely vegetable, usually vegetables are largely green color, or they are a hue, anything from yellow, orange to red color. Those are the carotenoids. When you do that the next time, just remember, every time you see carotenoids, all carotene, all, no exception, they come from GG. No GG, no carotenoid synthesis. Isn't that amazing? The plant needs it to make that. So beta carotene, lycopene, lutein, the whole ball of wax, everything, like they need GG to make. That's one. What about the green color? The green color is your chlorophyll. You have plant behind you like that. They're green color. Chlorophyll is a complex with a magnesium in the middle as a complex porphyrin ring. And on the bottom there is a tail. And the tail of a chlorophyll, for the chlorophyll to even work, is a tail of GG. So whenever you see green leafy vegetable, just think GG. That's it. So that's on the plant. Any animal, this part I know I'm going to make it simple. You're not going to forget this, Evelyn. And I wanted to make it simple also for the audience. GG is endogenous. So our body makes GG for specific reasons. I don't know if I know all the reasons, but I know enough now for the past 10 years to at least summarize in these three areas. I'll put it like that. First, the three big classes. It's an essential for synthesis, so it makes something else. Second, it has endogenous function. It does very specific things in your body. And the last one is GG is required to prevent side effects. So I'll do the first one first. Essential synthesis. About 40% of a human weight is muscle. GG is required for the synthesis of skeletal muscle protein. I said it in the simplest way I can. 40% of your body weight is muscle, is required for the synthesis of skeletal muscle protein. So when we get older, we have sarcopenia, the loss of muscle mass, because our body don't make enough GG. Remember, GG is not an amino acid. It's not a protein. It's just an isoprenoid compound. And without that isoprenoid compound, we cannot make this kind of protein. So that's one. So another synthesis, nutrient synthesis. Oh, what nutrient is he talking about? Two that I know. In time, I may even know more, but two. CoQ10. If you are looking at video behind my neck here, that's a long molecule of CoQ10. And here, that's a CoQ10 antioxidant group. And the long tail, carbon, hydrogen, black and white here, all the way here, that is entire tail. Oh, you see that? That is the molecule of GG. So 2.5 length of this guy, the GG, is the entire tail of CoQ10 in the back here. So GG is required for the synthesis of CoQ10. So everything you know about CoQ10, energy, muscle health, cardiovascular benefit, blah, 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 all this wonderful thing, it requires this. So today I'm here to tell you, to the best of my knowledge, as we age, we don't have enough CoQ10. Everybody know that. And you know that. Therefore, you supplement more CoQ10. Ubiquinol, all this wonderful thing. I'm telling you, the reason your body decrease in CoQ10 as we age is because your body don't make enough this guy. If you don't make enough this guy, therefore you don't make enough CoQ10. So it's for that. The next one. Another nutrient would be manoquinone. Everybody in the audience know about manoquinone 7 because everybody talks about manoquinone 7. But manoquinone are typically produced by fermentation in the colon. And usually the colon does not make much, if any, MK4. It makes long chain. MK7, MK10, 8, 9, 10, 11, 12, 13, the long chain. Somehow the bug love this. They make long. Now, I'm not saying that making manoquinone is no good in the colon. It's good. Because if they make those manoquinone, then you have good bugs increase and bad bugs drop. But when it's in the colon, those mevalonics are not absorbed. The absorption thing is in the small intestine. So now I'm going to tell you this part. The only mevalonate make inside your body is MK4, mevalonate 4. So whether you are a scientist or a lay person, don't you think you should ask, of all the mevalonites, why does our body only make MK4? You owe it to yourself to ask the question. You don't wait to have people confuse you and say, oh, in our colon, they make all kinds of mevalonate. That's correct. The bug is making those mevalonate, and the bug is making those mevalonate for itself, not for you. We are just thinking all so funny, and we're just lucky it make those mevalonate, so we have good bugs go up and the bad bugs go down. But the bugs are not making the stupid mevalonate for you. It's making it for itself, for its own survival. How about you ask a simpler question? Because I just told you the only mevalonate made in 25 organs in your body is MK4. Then I said, that begs the question, why is the human body make mevalonate 4? I don't think your body and my body is stupid. It had an evolution of years and eons of time to come to make MK4. Here, I hope I have arrested your attention. This is it. You're going to like this. If you take vegetable, green leafy vegetable, let's say this. That's phylloquinone. That's vitamin K1. That's the one that it goes into your body. You tear in your body will form clot and it will seal the tear. Just like if you got a cut in your hand, you wipe away the blood and then you got some very yellowish pus, and that's had to do with vitamin K1, that this guy. So if you take vitamin K1, it go this. By the way, only a fixed amount of this phylloquinone go in your body. Not everything you eat on the phylloquinone go in your body. If it does, all my vegan friends will literally clot to death. All my vegan friends do not clot to death. And why do I say? Because they eat a lot of vegetable. They eat food like rabbit food. So if they eat rabbit food, they got a lot of this stuff. So then they will have clot to death. They don't clot to death. So there must be another mechanism. I don't know. Do you follow what I'm saying? So they take this. Only a fixed amount of this goes in your body to prevent clotting. That's the K1. Most of the time at the gut, the tail, this is the ring, this is the tail. The tail is saturated in vitamin K1. They have enzyme. I purposely do this. So it just cut it off, and this is washed up. This is still green. It's from the plant. It goes in your body, and then your body is going to look for this guy here. I purposely chose it red because it's GG. The human body is flush with red like that. It's exactly the same shape as the green one that's been cut off. That is GG. And then the GG will find this one from the green plant. And then it said, you hear the sound? I just show you. That's MK4. That is MK4. And your body makes that. So now, why does your body make MK4? Your body makes MK4 because MK4 is responsible to make a protein called osteocalcin. And this osteocalcin will go into the bone and trap the calcium in place and make the calcium stay put. So therefore, your bone would not have mineral loss. That is MK4. So now, let me piece the whole bone story together. If you go backward, strong bones require calcium to stay put. Calcium will stay put there when you have this protein called osteocalcin to keep it put. And that is made by MK4. So the MK4 will sweep all the calcium from your artery so you don't have calcified artery and goes to the bone. And having said that, I'm giving you the piece that people don't talk about. MK4 can only be made by GG. you can see the whole molecule of GG on MK4, and that comes from GG. So early on, I told you that we did a study on tocotrienol. It make the osteoblast go up and osteoclast go down. Tocotrienol does not do anything to trap the calcium in place. That's a MK4 function. Tocotrienol only stimulate your body to have osteoblast. They make the cell that make strong bone, and less osteoclast. They make the cell that decrease the cell that destroy the bone cell. So if you have GG and tocotrienol together, it's as good as it gets. And you know, I'm really blessed to know this. When I discovered this from Annatto, this was not in my headspace. I was going after tocotrienol. And this monkey that's in the bottom of the pot called Gigi, I didn't even want to do it. I actually want to throw it away, you know. But then after, curiosity killed the cat. I just thought, man, I got to figure out what this is. And then found out Gigi. Then I don't know what Gigi. So when I start reading, I said, oh my goodness, this Gigi make the protein. And then the last thing would be, I know I'm dragging this thing out. So the essential synthesis make protein, muscle protein, nutrient as CoQ10 and MK4, and stimulates steroid production. So it increases testosterone. So we are studying people who have increased testosterone. Do that piece. Let me quickly tell you the other one, and then you can see what you want me to cover. It's also good for endogenous function. I already mentioned bone health, so I leave it there. It also helps in pain reduction. Now, the pain reduction thing, everybody is talking about cannabinoid. The cannabinoid work on the receptor due to the morphine alkaloid receptor. GG does not work on that receptor. GG work on heat. If you touch something hot, your hand goes back, heat receptor. But that is a pain receptor. And then touch, or you eat very spicy food, that heat receptor, that kind. Or a pressure receptor. If you stand strongly on your thing and your hand, and then your bone hurts you, not bone, your joint hurts you, that pressure receptor. And the last one is inflammation receptor. So therefore, if somebody take cannabinoid to manage pain, this could be something. So it's a pain reduction. And the last one is body temperature control. Not everybody is into this, but some people are. With the long COVID, people seem to have a malaise in their life, and sometimes their limbs are always cold, you know. But for me, I live in New England, and in the winter time, my limbs get cold. We are supposed to be warm-blooded. Warm-blooded meaning that when your temperature drops, you have warm blood, and your warm blood floods to your extremity and warm your finger. But if it doesn't warm your finger, that means that the warm temperature of your blood comes from the temperature from brown adipose tissue. White adipose tissue stores fat. Brown adipose tissue burns the fat and converts to heat, and the heat warms your extremity. That's it. Trust me. You cannot just have warm blood that go to your extremity and then your body will be same temperature. It had to come from somewhere. Scientists found out that the burning of brown adipose tissue comes from GG. If you don't have enough GG, it cannot give you brown. So I'm not going to go into a cold ice bath and stimulate my body to make brown adipose tissue. There are all kinds of YouTube out there, but GG is the reason how the body make brown adipose tissue. So that's 3 on endogenous function. So the last one is this, on reversal of side effects. Statin decimate CoQ10. Statin cause myopathy. Both of these come from GG. GG makes CoQ10, GG make muscle. That's why statin decimate. Women with osteoporosis are asked by the doctor to take bisphosphonate drugs. And bisphosphonate help to make the bone cell in the bone, but bisphosphonate somehow destroy the gum, the jaw gum here, and they have a condition called jawbone necrosis. So, and they found out that the necrosis, which means the death of the jawbone, is because the bisphosphonate so destroyed the gum cell. So, and they found out the death of the gum is because the bisphosphonate literally killed the GG at the gum, and therefore the gum died. So right now we're doing a clinical study. We will, when a dentist take away this, the tooth, and when they put cement in the lucerne, into the socket, they will put a drop of GG and then put in and suture it. We hope that with the GG in there, it would help to replenish the GG to the gum, and the gum would replenish. Remember, if that works and the myopathy thing works, and then helping people to have CoQ10 and MK4, I'm really glad I decided to analyze the GG. I was going to throw the thing away, and I did. So those are the three definitive function: endogenous synthesis, endogenous function, and then to prevent side effects.
Thank you so much, Barrie. I feel like it's actually sinking in. Like things are firing in my brain. I'm getting it. So thank you so much. And that's why I just let you go the whole time. We are running out of time. So I almost feel like this warrants, a follow-up discussion, because even though you touched on it, you talked about using GG and tocotrienols and vitamin K together, but we didn't even really get to dive into using it for people who are on statins or bisphosphonates. So I definitely want to follow up on that. I do have some questions that we like to ask every guest, and I think I have the answers, but what are your top 3 supplements that you like to take? I guess I should say, aside from tocotrienols and GG, what's your other favorite?
Yes, I have those 2 on. I think besides tocotrienol and GG, you make my answer better. I do take Design for Health multivitamin.
Okay.
It's called Primo Multi.
I love that one.
Yeah. And I tell you the reason why I take. I want to take a multi from different sources, but many multivitamin have a fair amount of alpha tocopherol, and I don't want it in. So about 3-4 years ago, I was able to convince Design for Health, you got to get the alpha tocopherol out and put instead the vitamin E that is tocotrienol. They did. So if you look, there are other goodies in Primo Multi, but for that reason alone, I took Primo Multi. Otherwise, the other thing in the multi is good. I also take CoQ10 because it's good for my heart. And the other thing that I take, I seem to be in love with lipid nutrient. I also take omega-3. I do eat fish, I eat seafood, but it's probably not enough. So I take approximately 1 gram of omega-3. I choose to make sure that the EPA and DHA. So usually each pill, soft gel may have 500 milligrams. So if I take one with lunch, one with dinner, that would be good. I know other people take much larger amount. For me, at least 1 gram as omega-3. So that's what I do. So I know one other question you would like to ask me would be, what is my favorite health practice? I know that it's going to come, so I might as well answer that one. And I know other people, great swimmer, athlete, skier, in another 5-6 months, I'll be 70 years old, but I want to stay active. So I go walking. I typically walk now about 10,000 to 15,000 steps. Yes, it is cardiovascular, and no, it is not a resistive exercise, but at least it get my blood circulating. We have 30,000 miles of artery in our body. So when I walk approximately an hour a day, sometimes I split in 2 half hours, the blood get going. That moving of the blood, many biochemistry is happening. So I think that's a good thing. So that's my health practice.
I love that. I love walking too. Walking's the best for so many reasons and for mental health. The last one, very quickly, I think I might know the answer, but maybe there's something else. What's something that you've changed your mind about through all of your years of being in this field? I'm guessing it's related to just, maybe the ideas that you had about tocopherols and then discovering tocotrienols, but is there something else?
To your last question, what have changed my mind? So I won't go on the less tocopherol thing. I do not take any supplement with tocopherol. I'll do this. I would have less calcium and more vitamin K2. The FDA say that the minimum amount of calcium is 2.4 grams. What makes me think so naively? If I take 2,400 milligrams of calcium, it would all go to the bone, and that it would not litter in my artery. What makes me think that? I don't like that when I pose the question to myself. I need MK4 and I need vitamin D to shuttle the calcium to the bone. So therefore, I would take less calcium. I believe that the amount of calcium I got from food is good enough, from bone broth, from food that I eat, they have calcium from vegetable, and take more things that would help my calcium to go to the bone. And the two that I know best that can help me in that area, Evelyn, would be MK4, vitamin K2, and vitamin D. So and I did not appreciate this as much before. I do now. So I make sure that I would take vitamin K2 and vitamin D and less calcium.
Thank you for sharing that. And I think we do need to schedule a follow-up conversation because there are so many more questions that I would love to go into and cover. So Barrie, thank you so much for this conversation today, for your contributions to our field, for advancing the knowledge in this field, and also all the research you've done, and clearly so much time, energy, money that you've invested, and to do it all with so much passion, and your contagious enthusiasm is very inspiring. So thank you.
Wow. Thank you so much for having me. And then for me, what is life when all you want to sit down there is to do things and just make money? I somehow was never raised like that. However, if you can make a living and somehow you can do something that can better people's health, what's there not to like? My mother-in-law used to tell me. So this is something I passionately want to give. So to the extent that I have my mind, my energy with me, I'll continue to do work on tocotrienol, GG, and also CoQ10. So those are the three things I do. If you come to my website, it only contains those three things. So thank you very much. Have a wonderful weekend, and blessing to all. Stay well.
Thank you, Barrie. Thank you for tuning in to Conversations for Health. Check out the show notes for any resources we shared from our conversation. And please share this podcast with your colleagues, follow, rate, or leave a review wherever you listen to this podcast. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based, cutting-edge research, and practical tips.